A nurse is assessing a client 3 days postpartum. Which Lochia findings should the nurse expect? Hi everyone, I'm Beatrice, a registered nurse. In this video, I'll look at Lochia. So I'll be looking at what Lochia is, the types, and nursing assessment, some important things you need to note, especially for your exams. So if you're ready for today's video, let's begin. After childbirth, a woman's body goes through some changes. One important sign of recovery is vaginal discharge, known as Lochia. Nurses need to know how to assess this. Also, even the patient, the woman that has just had a baby, need to know what is normal and what is not normal, what is abnormal. That's what we'll be looking at in this video. Now, let's look at the types of Lochia. We have basically 3 types of Lochia. We have Lochia rubra, Lochia serosa, and Lochia alba, RSA. So R for rubra, S for serosa, and A for alba. First, let's look at Lochia rubra. So this is red in color, bright red in color. So remember, rubra start with R, so and that's red. This one lasts for 3 days. Most times it's from day 1 to day 3. This discharge is bright red in color. Now, some women may have some variation. So I've seen women that get this discharge for more than 3 days. Some get it even up to 5 or 6 days. However, generally it's between 1 to day 3. That's what you're expected to know about Lochia rubra. Now, what is normal for Lochia rubra? It should just be like heavy periods. And also there may be some tissues and maybe little clots may be found in it. What is abnormal, what we don't want to see, is a foul odor, the woman passing large clots, large amount of blood that is soaking the pad too often. And if it is less, let's say the pad gets soaked in less than 15 minutes, that's an emergency. That's a sign of hemorrhage, so you need to act fast. Now, the next type is Lochia serosa. So this one is brown to pinkish in color. It's from day 4 to day 10. But like I mentioned, there's always variation. Some women can experience this even more than day 10, can get up to day 12. Now, what we want to see, what is normal for Lochia serosa, because Lochia serosa, why it is pinkish and brown, is because it contains old blood, some white blood cells, some serous fluid. So we don't want the pad to be too soaked often. So it should be a lighter bleeding. So the bleeding should decrease gradually. Maybe 1 pad in 4 to 5 hours. What is abnormal? Maybe this blood that is now becoming brown to pinkish now suddenly change to bright red, it's heavy, or maybe there's also foul smell. These are abnormal. We don't want to see that. We don't want to see large clots also. We can still see little clots, which is still normal, but we don't want to see large clots. The last type is Lochia alba. So this one is yellow to whitish discharge. This one is just like spotting. It decreases and it lasts from day 11 to up to 6 weeks. That's up to postpartum, where the woman comes for final checkup and they want to check to see if involution has completely taken place. So at this point, we don't want to see the thing going back again to bright red blood. We expect it to eventually even become purely white. And also, we don't want to see clots or any foul smelling discharge. We don't want to see heavy bleeding. It should just be a light spotting, as if you are just spotting, very light, and we don't want to actually see anything red in it. This should continue from day 11 to up to 6 weeks. Like I also mentioned, there are some variations. So in some women, it can last more than 6 weeks. But it should basically be just this white discharge. We don't want it returning back to red color. If you are watching this video and you've had a baby, I want you to share your experience in the comment section. How was it like for you, the discharge, the rubra stage, day 1 to 3? Was it exactly day 1 to 3, or you had it on a longer time? Also for the second one, which is the serosa, was it just from day 4 to 10, or you had it extended? How was discharge like? Also for the last stage also, I want you to share your experience so that others can learn. Now, nursing assessment and intervention. Now, as nurses, we need to know, at least first of all, you should know the types. You should know when to expect a red color, when to expect a brown to pinkish color, and when to expect maybe yellow to white color. And also, we should assess the amount, how many pad is saturated in an hour. So we need to know that if it is saturated in less than 15 minutes during that first 3 days of delivery, you should know that this is a sign of bleeding. It's an emergency. There should be an intervention immediately. You also want to ensure that there is no foul-smelling discharge. Again, you need to teach the woman the importance of perineal hygiene, because at this point they are having lots of discharge. We don't want them to have any infection. And also you need to teach them what is normal, what is abnormal, and when to seek help, what to look out for, and what to do when things doesn't go well. Let's say for instance the woman is having fever and is passing some clots. You need to teach them that for Lochia we don't expect any foul odor, any foul discharge. It could be a sign of infection together with maybe they are running fever. We also want to teach them at that point too, they should check their pad very well, note how many is saturated in an hour, and also tell them that we don't want to see heavy clots. We don't want to see heavy bleeding. For the 1 to 3 days where it can be heavy, but the heaviness depends on how many pads is saturated. But most importantly, we don't want to see heavy clots in that discharge. So these are some of the things you need to be teaching. And when there is time for you to intervene, as nurses, we need to intervene. Now, I made a video on fundal height. Now, something should be popping up for you to assess it. So, as nurses, remember when you are assessing Lochia, you're also checking the fundal height. You want to be sure that everything goes well. The uterus is not boggy and soft, and you are checking the discharge to be sure that the discharge is appropriate for that time and there's no sign of bleeding. So that wraps up today's topic on Lochia. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.